This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Your health is brought to you by the Health Broadcasting Service HBS radio channel. Our topic on this segment today is anorexia nervosa, a condition less spoken about, both generally and publicly. It is an eating disorder and a serious mental health condition at the same time. The term anorexia nervosa came up for the first time in 1873 by a doctor writing in the British medical journal The Lancet. In the article, the doctor used the terminology to describe people who, although thin and weak, insisted they needed to lose weight and would not eat enough food to remain alive. Anorexia nervosa is a nervous, psychological eating disorder characterized by refusal to eat, even to the point of starvation. Other symptoms are an intense fear of becoming fat that never goes away no matter how thin the individual becomes, an extreme overactivity, and an obsession with working out, negative feelings about the way the body looks, deep feelings of shame, plus or minus problems of drug and/or alcohol abuse. 95% of people who suffer from this condition are females. However, the remaining 5% are males. Anorexia typically appears during adolescence. Eating disorders are by no means limited to young teens. Sometimes young women in their early 40s suffer from anorexia. Some people just quit eating altogether, whilst some make themselves vomit immediately after eating. Some take laxatives after eating or do all three. At the onset of this condition, sufferers still have normal feelings of hunger which they train themselves to ignore. They oftentimes become obsessed with food and may even spend hours fantasizing about it, reading recipes, cooking methods, and so on. And sometimes some go as far as preparing elaborate meals for family and friends without joining in the eating, claiming they are not hungry. They often will argue that there is nothing wrong with them, and on the contrary, insist they really need to lose weight. Many ladies who are anorexic also suffer from bulimia, as they are both eating disorders hinging on weight loss. Bulimia nervosa is defined as the consumption of extremely large quantities of food in short periods of time, otherwise known as binging, followed by self-induced vomiting, or the use of other diuretics, or cathartics, in simple parlance, purging. When both conditions occur in the same person, this is known as bulimorexia. People who have anorexia try to keep their weight as low as possible by not eating enough food or exercising too much, or both. This can make them terribly ill because they start to starve. They often have a distorted image of their bodies, thinking they are fat even when they are underweight. A person with anorexia may be eating truly little, but the intestinal lining is sloughed off and replaced about every 3 days. This sloughed tissue creates fecal material, and stool continues to form even when oral intake is exceptionally low. So, what characterizes bulimia? Bulimia is also an eating disorder and a mental health condition just as anorexia. As previously discussed, people who have bulimia go through periods where they eat a lot of food in a relatively short time, known as binge eating or binging, and then make themselves sick, using laxatives, or engaging in excessive exercise, or a combination of both to try to stop weight gain. Men and women of any age can get bulimia, but again it is most common in young women and typically starts in the mid to late teens. The main difference between the diagnoses of anorexia and bulimia is that anorexia nervosa is a syndrome of self-starvation involving significant weight loss of 15% or more of ideal body weight, whereas people with bulimia nervosa are usually by definition at normal weight or slightly above. How do you feel when you have anorexia? People with eating disorders tend to be inflexible and rigid in thinking. They may become impulsive in times of distress and lose sight of their goals. Many times, a person with anorexia is often unaware of the uncomfortable emotions driving their behavior, because they are so removed from their emotional experience. How does anorexia impact on lifespan? Can it shorten life? Like an aggressive form of cancer, it will not stop until it wins if undeterred. The disease has the highest mortality rate of all mental health disorders. As many as 20% of the people who suffer from anorexia will eventually die from it. And the longer a person suffers from anorexia, the greater the risk of dying from the condition. It is, however, a treatable condition. These are some of the signs and symptoms of anorexia to look out for. Your weight and height being lower than expected for your age, especially when under 18. As an adult, if you have an unusually low body mass index, popularly referred to as BMI, or you are missing meals, eating extraordinarily little, or avoiding eating any foods. If you are seeing every food as fattening, or believing you are fat, when you are of a healthy weight, or underweight. If you start taking appetite suppressants, some medicine, to reduce your hunger. If your periods are stopping, and you are a woman who has not reached menopause, or as a younger girl, you are not starting menstrual periods. Physical symptoms such as feeling lightheaded or dizzy, hair loss and/or dry skin. Deliberately making yourself sick and undergoing extreme exercise regime, or using medication, laxatives to increase excretion, or diuretics, some medication to increase urination, believing that these would prevent weight gain. Then you need to talk to a trusted, knowledgeable confidant, or a health professional. The risks associated with anorexia nervosa are severe, and can be life-threatening. They include anemia, that is, iron deficiency, and compromised immune system, resulting in a reduced inability of the body defenses to fight common ailments and diseases. It is not unusual for sufferers to get sick more often. Getting help and support, as soon as possible, gives you the best chance of recovering from anorexia. If you think you may have anorexia, even if you are not sure, see your doctor as fast as you can. You will be asked questions about your eating habits and general health. Some blood tests may be ordered to rule out other causes for your weight. Finally, you may have to be referred to an eating disorder specialist or other relevant team of specialists. It can be extremely hard to admit you have a problem and to ask for help. If it helps you or makes things easier for you to take a friend or a loved one to your appointments, then do so. You can also talk in confidence to an advisor or a trusted friend. Getting help for someone else. If you are concerned that a family member or friend may have anorexia, let them know that you are worried and concerned about them and encourage them to see their doctor. You could offer to go along with them. You can recover from anorexia, but it takes time and recovery rate is different for everyone. Your treatment plan will be tailored to your needs, and should you consider any additional support, such as depression or anxiety support, ask for it. If you are over 18, you should ordinarily be offered some talking therapy to help you manage your feelings about food and eating so that you are able to eat enough to be healthy. Talking therapies are commonly used to treat anorexia. Such therapies may include, but are not limited to, cognitive behavioral therapy, otherwise known as CBT, mantra, an acronym for Maudsley Anorexia Nervosa Treatment for Adults, and Specialist Supportive Clinical Management, SSCM. If you are under 18, you should ordinarily expect to be offered family therapy. Long-term health risks of anorexia include severe health problems associated with not getting the right nutrients, known as malnutrition. But these will usually start to improve once your eating habits return to normal. Possible complications from anorexia include problems with muscles and bones, including feeling tired and weak, osteoporosis, and problems with physical development in children and young adults. Other associated complications are fertility problems and loss of sex drive, libido. Problems with the heart and blood vessels, including poor circulation, an irregular heartbeat, low blood pressure, heart valve disease, heart failure, and swelling in the feet, hands, or face, edema. Problems with the brain and nerves, including fits, seizures, and difficulties with concentration and memory, kidney or bowel problems, having a weakened immune system, or anemia. In total, anorexia can put your whole life at risk. It is one of the leading causes of deaths related to mental health problems. Deaths from anorexia may be due to physical complications, or even suicide. The causes of anorexia are not exactly known, but researchers suggest that some people are prone, especially if you or a member of your family has a history of eating disorders, depression, or alcohol, or drug addiction, or you have been criticized for your eating habits, body shape, or weight and have become oversensitive about your physique. Or it sometimes happens that you are overly concerned with being slim, particularly if you also feel pressure from society or your job, for example, ballet dancers, jockeys, models or athletes, or you have anxiety, low self-esteem, an obsessive personality, or you could simply be a perfectionist. People who have been sexually abused may also later suffer from this condition. Anorexia causes a large calorie deficit, leading to extreme weight loss. People with bulimia can experience episodes of anorexia, but they still tend to consume more calories overall through binging and purging. While the psychological pieces to eating disorder, recovery is often a lifelong endeavor for many individuals. The average length of stay for our lower levels of care can vary from about 4 weeks, partial hospitalization program, to 8 weeks. How long do eating disorders last? Research carried out in Australia suggests that the average duration of anorexia is 8 years and 5 years for bulimia. However, these illnesses can also become severe and enduring, lasting for many more years, and having a hugely debilitating effect on the sufferers and their families. I should also mention that male sufferers experience decreased testosterone. Gastrointestinal problems, such as constipation, bloating or nausea, equally affect both male and female sufferers, as with all other previous discussed in this segment. Because an individual with anorexia is eating at an extremely restricted level, the muscles throughout the digestive system can begin to weaken and atrophy. In turn, a condition called gastroparesis develops, in which the process of emptying the stomach becomes significantly slower, or even stops altogether. Trying to lose weight in unhealthy ways and means can predispose to anorexia nervosa and bulimia, which are both eating disorders. However, bulimia nervosa tends to develop late in childhood or in early adulthood and typically affects more females than males. People mistakenly think of eating disorders as phases, fads, or lifestyle choices. They are serious life-threatening disorders. If you are listening to this broadcast and you can identify with any aspects of our discussions today, please get in touch with your doctor, and if you do not have one, go to an outpatient department of your local hospital and seek help. Your health matters. For your comments and questions, please email contact@healthbroadcastingservice.com. Please subscribe to our channel to stay abreast of future informative health topics from the Health Broadcasting Service. Your health matters. Until next time, stay safe and healthy.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel.